everyone. Sorry we're a little bit late again. I had some clients turn up an hour late, so there we go. We have a few questions for this week, which is good. And I'll just sign in to find them. And there are also a couple of things I was going to talk about because they got me excited, which might just be because I'm a nerd, but yeah, so let me get my Facebook up on my laptop so that I can Facebook. Yeah, how's everyone's week been? It's been pretty horrible weather here, but that's actually quite nice. It's made it feel a bit like home, which is nice. And yeah, getting a little bit fed up of it today because everything is muddy, but I should be used to that really by now. Chickpea, no. I'll show you Chickpea in a second. He is, no, Chickpea, go on, no. He's trying to escape his, come on. I'm just bribing him to stay in his little crate with treats. Right, where are we? Here we go. Okay. Ooh, right. Questions. So, where are you from in Wales, Catherine? I'm sure we've been through this before because I have a house in Abergavenny, and I can't remember where you said in Wales you were. Hi everyone, hi Tina, hi Vicky. So Tina, we're going to start with your question. How long are you going home for at Christmas? I am going home for 2.5 weeks and I am beyond excited. I have already ordered my Terry's Chocolate Orange Baileys, so I'm going to be having my coffee with Baileys and I'm really excited because my 2 nephews and my niece are all going to be around, and it's my little brother's wedding just after Christmas as well, so it's going to be a super festive, busy party kind of year, and it's going to be good. I'm very excited. Going to see some friends, and yeah, it's going to be amazing. So I leave at 6 a.m. on the 22nd. I get back at about 3 in the morning on the 7th, and then I'm back at work on the 8th. So I've got the 7th to kind of chill out and yeah, kind of get back into Kurdistan life. The Highlands of Scotland. I do miss Scotland. I miss it a lot. I wish I could make a trip up there in these 2.5 weeks, but I think that's very unlikely. I might be able to squeeze in a little trip to Wales, but I think yeah, Scotland's probably out of the question, sadly. So that was question number 1. Question number 2, what are we planning over Christmas at the shelter? Do the dogs and staff get a special Christmas Day treat? They do. Abertillery. Yeah, I know. Oh, lovely. Yeah, I can imagine you guys are all a lot more fed up of the rain than I am. Hi, Zubaida. So yeah, question number 2. What are we planning at the shelter for Christmas? So Louise is coming over. She arrives on the 21st. And on Christmas Day, we don't really book anything in for the clinic. We keep it nice and quiet. We hope nothing new comes in. And we have a little staff party in the staff accommodation. Louise bakes some lovely Christmas desserts. And the boys all get a little present. And hopefully, weather and internet and everything allowing, we do a little live and we give all of the dogs a new toy. So all the dogs get a new toy, the boys get a little present, and we have a little kind of staff party in the staff accommodation, which the boys all love. So I am kind of sad that I'm going to miss that. That's yeah, it's going to be sad, and I'll probably end up having to FaceTime Louise to say hi to my girls because they're staying here for Christmas, which is the one thing, well, not the one thing, but one of the big things that's making me a little bit sad. It's going to be a little bit bittersweet because, yeah, my 2 are staying here, sadly, because, yeah, it's just too much to take them out just for 2.5 weeks. Nick, is Nick there? possibly not, because she's gonna catch up later. What happened to the puppy named Bo? He is outside. He's doing really well. He he's a little bit nervous, so he's not one of the dogs that lets us catch him easily or play with him or stroke him or anything, but he seems very happy outside. Sorry, just someone asking something. And yeah, he's doing really well, actually. He's really happy out the front gate. We have quite a few puppies out there who are causing quite a few well, there's just a lot of dogs outside the front gate currently, and a lot of dogs generally just moving into the driveway because we've got a lot of building works going on. So if we were full before, we're kind of even more full now, which is difficult, physically and emotionally, because I keep finding dogs that I don't want to put back outside, but I have to. Have I found the cases in the clinic more complex than I thought they would be? Yes and no. So the I hope they will, Catherine. I'm sure they will. I'm sure she will spoil them. I'm expecting to come home to two very fat dogs, and having to put them on some very strict diets. So yeah, how complex are the cases? Medically wise, I think less complex, simply because we don't do as much workup. We do what we can, but obviously we don't have the capabilities to treat hugely complicated medical cases, like your endocrine disorders, diabetes, things like that. We don't have the capability to treat. So those dogs tend to, and also the animals here, I think, don't tend to live long enough to start getting those, start getting those diseases. Or they're not picked up, and then kind of by the time they are, they're so sick that we tend not to do diagnostic tests and things. So medical cases wise, it tends to be a lot simpler, but wound care wise, it tends to be a lot more complicated, because we get a lot bigger wounds. And well, I suppose though, if the wounds just aren't healing, then we, like if it's getting to a point of putting skin grafts and stuff, we can't do those here. So yeah, yes and no, but we treat a lot of wounds here that are a lot bigger and more complicated than I would see in the UK, because most people don't let their dogs off lead in the UK, and so they don't tend to get attacked and things. Same, I suppose, with trauma. Less animals are kind of hit by cars or attacked and things like that in the UK. So although you get sort of cats that have had collisions and things, I think you see it less in the UK than you see it here. So trauma-wise, probably more complicated, but then I also wasn't an emergency vet in the UK, so yeah. But medical-wise, probably simpler, just because we don't have the capabilities in country to deal with super complicated medical cases, and we don't have the drugs either. We had a CPD day the other week, which was really interesting, on feline medicine, and they were talking about new drugs for treating diabetes in cats, but yeah, we don't have access to that here, so that's not something that we'll be able to treat. And those kind of hormonal medical cases require so much monitoring and careful care, really, that we're just not able to give here with the number of dogs that we have. So yeah, good question. Interesting. I hope I answered it well. I have had a coffee today. I don't know why I keep yawning. I also slept really well, apparently, according to my Garmin. So have the dogs ever experienced snow at the shelter? So I had to ask Louise this one. There have sometimes been a few sort of snowflakes dropped, but nothing, not kind of any decent snow. My two have obviously experienced snow, but yeah, the shelter dogs, I don't think they've ever experienced proper snow. Bryn is doing really well. We will try and do a little catch up on him today. I'll try and do a little catch up on Bo as well. Bryn is now in one of the outside kennels. He has a little jacket on because it's quite cold. He had a bath today because he was still smelling quite yeasty. And I'm trying, my plan was to get him and Chickpea to be friends, but we let them both out into the airlock today, and Bryn was fine. Bryn had a good time, and Chickpea apparently is a bit of an escape artist, so he managed to jump over a gate and get behind the clinic. Thankfully he didn't jump over the wall to the outside, but yeah, he's now not allowed outside without supervision. So he is now, let me see if I can show you, he is now in clinic jail, but I think he likes it more than being in an outside kennel. So this is my little makeshift crate for dogs. We have quite a few dogs in clinic all the time, so this was where Harley was, but you're right, Louise, Chickpea is a she. I keep calling, I don't know why. Sometimes dogs just and cats just get in your brain as either a he or a she, even if they're not. And for some reason, in my head, Chickpea is a he, but Chickpea is a she, and I will get it. But she is here now. So hi, Alison. Oh, so nice of you to join us again. And so this is my little makeshift crate that Harley is usually in, but Chickpea is now in because Chickpea doesn't like being tied up. So she tends to roll and break leads and things like that. So we're going to keep her in this little crate until she's kind of used to it and a bit more comfortable. And then, yeah, she does need a nice pink t-shirt. She's quite skinny, so maybe I will find one for her. And then I've moved Harley over here. Maybe I should put the pink lead on Chickpea. Harley's just outside currently. And then you got my two here, and then Louis is usually over here. So that's how we roll in the clinic. Thankfully, we're a few cats down now. Some cats got picked up yesterday. So Donald and Hamish and Hero got picked up yesterday. So they are less distracting. There's less distractions going on for the dogs. So, but I think I'm kind of at my limit of number of dogs in the clinic. Although I'm sure at some point I'll bring more in. And then, yeah, so that was Chickpea. What is the dominant breed? So Catherine, you asked this one. What's the dominant breed of the street dogs? No, Chickpea. No, 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 no. I'll have to show you guys this because it's really cute. No. Go on. Go on. You can't come out. You've got your Kong. Hey, look, there's still food in there. She's giving her back her Kong. There you go. Yeah. So the dominant breed in the shelter is Pishtar, which is the local livestock guardian breed, or Pishtar mix. So they're kind of big, kind of look like a mix between a Pyrenees and a Mastiff, maybe. No, Chickpea. No. And no, Chickpea, no. Chickpea, no. Well done. You have your Kong. I'm gonna have to bribe her with like a million treats, I think. She did settle the other day when she was in here. So she will eventually. But yeah, so it's mostly Pishtar dogs. They're kind of like big white or light brown Mastiffy cross Great Pyrenees kind of dogs. Really big, and we get quite a few Salukis, and otherwise it's just mutts. So yeah, a lot of people come to our shelter and are surprised at how big our dogs are, and it's because they've mostly got some of the Pishtar in them. So yeah, that's what the majority of the dogs are. And if you go out kind of sort of into the countryside, you'll see a lot of the Pishtar dogs with sheep and things. And actually a couple of weeks ago we got a farmer coming by because he wanted a dog to guard his cattle, and I told him no, and he obviously was really confused because he could see like 700 dogs, and he was like, I just want one dog for my cattle. And I was like, no, we don't do that. He obviously thought I was crazy, which I probably am. So yeah, that's that. And then so one of the things I wanted to talk about today was Atlas. He very sadly was euthanized earlier in the week. So he was absolutely fine in himself the day before, and then he came in very lethargic and vomiting, and we give me 2 seconds. Hi, sorry, I'm in the middle. I'm so sorry, he let me in, that's why I came in. Sorry. No, that's fine, that's fine. You can give me a half an hour. Sorry, someone was supposed to come for an appointment at 11 and they've just showed up. So, but they're happy to wait. So, yeah. Oh dear, and the 2 puppies are in. Yes, cats that need their eyes. Give me that pen, Holly. Yeah, it is quite common in the UK, but we tend to go through phases of. Let me just put these 2 dogs away. Oh, come here, you. Why are you growling? So we tend to see things in blocks here. So you tend to get like maybe a month where you get loads and loads and loads of wounds, for example, and then you'll get a month or 2 where you get loads of eye issues, and are you okay? And then you get like a month or 2 where you'll get loads of vomiting or something like that. So yeah, it seems to have come in a block of cats needing their eyes out, and I think the one that's just arrived might be another one. So we'll see that in a second. Hang on 2 seconds. Okay, I'm in the middle of something. Can you give me 15 minutes? Give me 15 minutes, okay? Thank you. Right, I think I'm going to have to go soon, but I will tell you all about Atlas and we'll have a quick discussion on that. And then I'm going to have to go. So Atlas, yeah, unfortunately, he came in vomiting and he was quite quiet. Harley, stop it. And but we did an x-ray and we couldn't see anything massively obvious, and then when he came around from the anesthesia for the x-ray, he was kind of up and around, so I was sort of like, okay. We took some bloods and he had high white blood cells, which is quite suggestive of an infection. To be specific, his neutrophils were high but his lymphocytes were low, but his biochemistry, so sort of looking at his organs and things like that, were all fine. Like his kidneys were fine, liver was fine, everything like that was fine. So we gave him some pain relief, some antibiotics and some fluid therapy, and then at sort of 5 p.m. Hi Philippa! Harley! Ooh, interesting. Gosh, no one wants me to do this live today, do they? Oh, thank you for joining, Vicky. Holly says thank you as well. So yeah, Atlas, we gave him some pain relief, some antibiotics and things like that, and then at sort of 5 p.m. I went to check him again, I know, it's a bit crazy, Catherine. And he just didn't seem right. I was kind of expecting him to be a little bit more lively, and he'd had some quite strong anti-nausea medication. It didn't do anything to you. So I was expecting him to be wanting to eat a bit more, and he just wasn't. So I did an ultrasound scan, and there was quite a lot of fluid in his belly. And I tested the fluid, and it was what we got. Can you just stop, puppy? Can you just stop, or I'll put you outside for 10 minutes. Should we do that? Yeah, I think we should do that. And there was fluid in his belly, and I tested it, and it was what we call yes, me and Louise were chatting about this morning, Tina, and it was what we call serous sanguinus, which is kind of like your normal transudate with a little bit of blood in it. Louis, enough, thank you. And so it wasn't frank blood, which is what you would expect if he'd had, say, a hemangiosarcoma of the spleen, so a tumour of the spleen that had ruptured or something. So we decided to do what's called an exploratory laparotomy, which is where we kind of open the abdomen surgically and have a look and see what we can find. So we did that, and enough. And we... Now he's going to eat the pen. Honestly, these dogs. So we did that, and we found a lot of kind of bilous fluid in his abdomen. And I couldn't find where it was coming from for quite a while. And I thought it might have been coming from his gallbladder, but eventually we found a hole in his stomach around the pylorus. So, that's not something that we would be able to fix here, or at least we wouldn't be able to monitor it well enough after surgery for it to be okay. So we made the decision to euthanize him, and it was really, really sad, but and we were trying to figure out what had caused it, because he was on Metacam, but he hadn't been on Metacam for that long, and he'd been on, you know, high quality Metacam and everything. So I've had a little look into it this week, and a thought that came to me this morning was that obviously in humans, stress can increase the risk of stomach ulcers, right? So I had a little look into it, and apparently it can do the same in dogs. So I'm wondering if the fact that we have dogs in a shelter environment, so they're kind of living under a bit more stress than if they were owned dogs, increases their risk of gastric ulcers. And I was going to run through a whole load of things, but I don't think my brain is working with all these dogs barking and people wanting me. So what I might do is save that for next week. So next week we will have a little chat about gastric ulceration and gastric issues in general, and stress in animals, and kind of we can have a little chat about feline lower urinary tract disease as well, which is a well-known physiological reaction to stress in cats. So, oh, Catherine, it was lovely to have you join us. And yeah, I think I'm going to sign off now because everyone is wanting me at the worst time. And we will run through those things next week. And obviously, if you have any other questions you want me to run through next week, then just pop them here or on the reminder post that we put up next week. And I'm sorry it's been so short today, but yeah, a bit of a hectic day. So yeah, I'll see you all next week. And it was fun to have a chat, however short it was.